Hello everyone. I am Dr. Manish Chhabria, consultant neurologist at Sir H.N. Reliance Foundation Hospital, Mumbai. Today we will be talking about Alzheimer's disease. So what is Alzheimer's disease? It is a slowly progressive neurodegenerative disorder of the brain where the patient initially manifests with memory loss and then gradually as the brain cells degenerate, additional symptoms like confusion, disorientation, difficulty in planning, difficulty in taking judgment, losing their way back home, and many other symptoms, including behavioral symptoms, will come. So, one should know how to diagnose Alzheimer's disease, or how will a family know that their loved ones is suffering from dementia and Alzheimer's disease. So, what is Alzheimer's disease and what is dementia? Everybody asks this question. So, dementia, as I said, is a slowly progressive neurodegenerative disease, and Alzheimer's is the commonest form of dementia. So, how does one know? So, first is the symptoms. As I said, memory loss, confusion, disorientation, making errors at home, difficulty in judgment, losing their way back home, behavioral symptoms. So the symptoms bring the patient to the hospital. Second things, we do a detailed clinical neuro examination in our clinic, where we do a detailed general system examination and a neurological examination. We advocate mini mental state examination, Montreal cognitive assessment. These are the scoring scales which we do in the OPD, which tells us how much the brain is affected. After those initial screenings, we, if required, we do certain blood tests and we do certain scans before we reach to a diagnosis of Alzheimer's disease. Besides the diagnosis of Alzheimer's disease, one needs to remember that there are correctable forms of memory loss or correctable forms of dementia which can be detected on simple blood tests like a B12 deficiency or a thyroid deficiency. So these patients have a rapid form of dementia and they are correctable forms instead of the neurodegenerative form of Alzheimer's disease which we have already discussed. And then once we prove that the patient has early onset Alzheimer's or advanced Alzheimer's disease, accordingly a care plan is made. Some patients may have an earlier stage of dementia which is called the MCI, which is the mild cognitive impairment, and once we know that, accordingly a treatment plan is made. So there are lots of medications which are coming up. As the Alzheimer's disease is a degenerative disease, there is no cure for it, but as time is going, a lot of medications are being discovered and many trials are going on. Besides the medicines, what challenges are faced by the patient and the caregiver are important. For the patient, he may have difficulty in looking after himself, bathing, brushing, feeding himself. He can't take a decision about himself, about his surroundings. There comes the role of the family and the caregiver. The family has to support this patient. They should see that the patient eats on time, feeds on time, takes bath on time. When he's moving about the house, he should not injure himself. Patient needs to socialize within the house, within the family, and with the friends, and his social circle needs to be maintained. He should not injure himself. He should not be in an environment where he can cause harm to himself or to others, like if he's going in the kitchen and forgetting to switch off the gas, if he's forgetting to keep the keys of the house and forgetting about it, he's giving money to somebody and then forgetting about it. So the family needs to support the patient in all this. And medications have to be taken on time. All this, when the family is looking after this patient, the caregiver themselves come under stress. So they have to look after themselves. They may undergo depression, they may undergo anxiety themselves. So the caregiver needs to look after themselves. They need to feed themselves. They should be part of support groups. They should meet people to understand how those people are looking after their patients. So caregiver challenges, patient challenges, all that form a part of a clinician's approach to managing these Alzheimer's disease patients. Thank you.